Yesterday we were saying we have to analyze the posture by means of lateral side, anterior side, and posterior side. We have to look everywhere around. Clear? Vigilant? From this side, when we are seeing, we are speaking that the line of gravity must pass from here, the center, the vertex, through the earlobe, through the neck, through the thorax, through the pelvis, the lumbar, pelvis, knee joint, thighs, top region, ankle, everything, right? Exactly. When we are speaking about the cervical region, we are speaking that the line of gravity or the imaginary line passed through this for assessing the posture should pass through the cervical region by means of two different areas. The upper cervical region, where it is passing at the utmost the anterior one-third of the cervical region and vertebral column. The middle and the lower region, it should be passing just at the lower posterior one-third or just behind the posterior one-third of the cervical vertebrae, right? And then it will be passing through the thoracic region, almost at the center, and then again the main thoracic course. During the main thoracic course, it will be passing in front of the thoracic vertebrae, and in the lumbar region, it will be passing most probably exactly through the center. Most probably exactly through the center, and at the sacrum, especially at the S2, exactly represent exactly through the center. That's why we call it as center of mass, right? And then it will be passing through this. Then in between, it will be passing in between the symphysis pubis, and then it will be passing in between both the legs. It will be reaching at the ground. This is the thing. And we were assessing all the regions, and I was telling you how far the posture will be affected. According to your syllabus, I was telling you what is that posture, what is this posture, what is that posture. Now we are going to analyze little bit detail. Okay. Now you are going to see this sideways plus anterior view plus posterior view, all the views. Okay. The line of gravity is passing through this. Suppose imagine the posture is not aligned like this. The posture is like this, right? Okay. How it is maintained in this position? Before that, how it is maintained in this position? What are the muscle activity? You can see here. You can see here. All these things are symmetry, right? Both the sides it is equal in height. Here also both sides it is equal in height. See the length between the earlobes and the AC joint. Can you see? All these things are equal. Both the shoulders are in equal size. It is not elevated or depressed, right? It is not like this. It is normal. Both are equal, right? You can see alternates. Here, as well as here. Actually, how it is maintained? What are the muscles are acting on this? Which muscle is maintaining this posture? How the neck is, how the head is being balanced? Which muscles are acting? Anyone? Roughly speaking, I'm not asking exact muscles. What is the muscle? Where the muscles will be? These posterior neck muscles are working so that it is contracting here, so that it is maintaining the head in this position, right? And the anterior muscles are cooperating according to that. So axis against, it axis and against. When you come here, what is happening? The neck is not like this. The head is not like this, or deviated like this, or rotated like this. It is so straight. So which muscles can be working? At the side of the neck. Trapezius, pectoral, all these muscles which are present at this side of the neck. These muscles will be working, right? And the scapula, when you look at the scapula, it is not being like this. It is in normal ways, right? This caption is normal. This scapula angle is normal. And how this is maintained. What are the muscles can be working? The muscles which are present around this region, this scapular region. These scapular muscles are working, right? I want that answer. These scapular muscles are working, right? So because of that, this scapula is maintained in this position, right? So the head is being in this position, the scapula is being in this position, right? This side neck muscles, they are also working. So the head is being at the upright position. All these muscles are working. Posterior muscles, the anterior muscles are cooperating according to that. Then side of the neck, these muscles are working. then scapula muscles. These muscles are working. Now, one question. When these muscles are affected, what will happen? When the posterior muscles are affected, what will happen to the head? It will fall down. Right? So to compensate that, the human posture, what it will do? It will come like this. So it will come like this. Can you see? So there will be the line of gravity will be passing like this. To compensate that, there will be weakness here. The upper cervical and the nuchal ligament, those regions, there will be tightness. So it will come like